So let's begin by talking about the public reporting itself. For those of you who have been in home health as long as I have, and we're not going to talk about exactly how long that might be, you will remember that in 2003, the Centers for Medicare and Medicaid Services first posted the Home Health Compare information. These publicly reported measures, this information, included outcome measures and process measures. On your slide, you have definitions. It's important that we remember, outcome measures tell us how well the provider has assisted their patients to regain or maintain their ability to function. A process measure evaluates the rate at which you as a provider have used specific evidence-based processes of care. This data is downloadable and available at the web link here on this slide. Throughout this presentation, I will be calling your attention to various web links. These are very important resources for you, and I hope you will take advantage of them. This slide gives you a better overview of the actual public reporting different reports. I want to call your attention to the color difference. On your left, you have the confidential reporting in the salmon color. These include the review and correct reports themselves and the quality measure reports that give you the reports measure by measure so that you can see how you have performed. On the other side, you have the publicly reported information. The provider preview reports are confidential for you to look at so that you know before the public how your outcomes and your process measures look. The Home Health Compare data is truly public, and it is available to your patients, their caregivers and family members, your referral sources, and anyone who wishes to see how you have performed. The CASPER themselves, there is a lengthy list of them, but we're going to begin by looking at the review and correct report. This is a user-requested report. That means that you can go in and pull this report yourself. It's going to give you numerator and denominator counts for OASIS assessment-based quality measures by quarter. This is non-risk adjusted quality measure result scores. That's an important factor. It's going to identify if missing or corrected OASIS data should be submitted prior to that quarter's data submission deadline. And it includes only that OASIS data that has been submitted and accepted prior to the quarter's data submission deadline. Quality measure reports are also user requested. These provide process and outcome quality measure result data. It's confidential feedback for you on your agency's performance. Some of this result data is adjusted where that is applicable. Claims-based measures are also included in the agency-level reports. And it does, again, include all data submitted from the OASIS assessments that have a target date that falls within the requested reporting period. The target date, not the submission date. An important difference to hold in thought. Provider review report, remember on our color-coded slide, it showed you this. This is confidential. It's in the CASPER reports. It's a shared folder within the CASPER list. It's available quarterly, and it comes out approximately 3 months prior to the data being displayed on Home Health Compare for the public. This gives you an opportunity to go in, pull this report, and review the agency-level risk-adjusted assessment and claims-based quality measure data. This information is going to be appearing on the Home Health Compare website. So you do want to look at it and understand what it's telling you. Know that the measure results you see here are final when they appear here, and they cannot be updated.